Hello, Northport. I'm Pete Lear, along with Northport Fire Rescue Chief Scott Titus. We're here this evening to talk about what the city is doing to best protect residents from COVID-19 and how we're working to react if necessary. So we've put together some questions that you might have, and then we can attempt to answer your questions. So just send them in along in the comments, and we'll try to get to them. So the initial question, I'm going to ask Chief, what are you doing on a daily basis to keep up with this evolving situation?
I think first on a citywide basis, we met early on as this was beginning to unfold and talked about through emergency management with the different directors to find out essential staff if they were able to work from home and things that they could do where they could work remotely, so that as this began to ramp up and we had more issues, that we were better able to protect our staff and then continue doing the operations of city business. So I think that's gone pretty well throughout all of the departments. And specifically in the fire department, we've done quite a few things to try and take lessons learned from other areas around the country and even around the world, where looking at lessons learned from other fire departments and put some things into place that better protect our personnel, so that we're there on the streets to be able to protect our community. So those things vary from, simple checks in the morning when crews come on, temperature checks twice a day, no cross-contamination of crews, so the oncoming crew stays outside until the offcoming crew leaves and they clean the station on their way out. We've separated fire and EMS crews, so there's no cross-contamination there. We're running calls a little differently. So there's been a lot of operational things that we've put in effect that I think better safeguard our personnel and so that they're there to provide for community safety.
Sounds good. I know that from the very beginning of this, we've told everybody this is a very fluid situation. It's not our normal emergency that we're used to dealing with in the state of Florida, which is hurricanes. And we've told everybody this is going to be one of those scenarios that is going to change very rapidly, almost on a daily basis, sometimes even faster. And can you tell us how some of the things have changed for you over the past few weeks when dealing with this pandemic?
Absolutely. Well, in the early stages of this, as I said, we began to look at how to safeguard our personnel, how our operations may or may not change. And literally, as we've received updates of information, from the federal government, from the state, local government on how things are being done, we've changed our policies sometimes daily to try and stay ahead of some of those changing conditions and things like that.
Sounds good. We'll go to the first of our resident questions. Are cloth masks as effective as commercial ones? And is there anyone in Northport who has the virus?
Well, two-part question. So first, I will say any research you can do a simple search online that will say most cloth masks are not quite as good as commercial grade masks. However, commercial grade masks vary all the way from N95 masks, which are recommended, but they have to be fit tested, to a simple surgical mask. So there's even varied degrees of protection in those. There are a lot of things out there right now where people are producing homemade cloth masks that actually have some pretty significant protection, but there are so many different materials and so many different methods that are being done, it's nearly impossible to try and say to what level of protection they offer. The great thing that I will say is that while the supply chain is difficult and some of the surgical masks or the N95s are unavailable, a cloth mask certainly provides a greater level of protection than nothing, and it certainly adds a level of protection that's protecting other people from you if you happen to be a carrier of the virus, as well as you from other people. So,
sounds good. And the second part of that was, is there anyone in Northport who has the virus?
So yes, I believe last count today was 20 people, I believe was the number, that have had the virus, and 30, I apologize, 30. We have only, through fire rescue, we've only had to transport 3 to my knowledge. So daily we keep track of the type of calls that we go, and we kind of close that loop so that we know what we've done.
Okay, thank you. One of our residents asked, do we know how many cases there are in specific zip codes? And this one was asking for 34286 and 34287. Now, one of the things I'll share with them on this one is, anytime that you want to know how many there is, you can go to the City of Northport's website, which is www.cityofnorthport.com/alerts, and look for the case count on the dashboard. This is updated at least once a day. You can search by zip code using a tab on the bottom of the screen. And currently it shows 5 to 9 cases in 34286 and 13 in 34287. So again, it's one of those things where we recommend you go to our website for answers like that, because it will be changing. While those numbers were accurate earlier today, if it's been updated since then, they will have changed. So one of the other questions here is, how is local testing going?
So Sarasota County had a testing site. One of the first testing sites that started in Sarasota was at Twin Lakes Park off of Clark Road. I believe they have just closed that testing facility up there. They're looking for a new site right now. I believe they're opening up in downtown Sarasota. And then after that, I think they're going to have a site test down here in Northport. We were actually discussing today on what that location would be. So they're trying to set those testing sites up in areas where people may be having some difficulty actually getting tested. One of the other great options, and some people are not aware of it, is if you think that you may have COVID-19, you're having flu-like symptoms, and you're concerned about that, you can call your doctor, and your doctor can prescribe you to get a test. They will let you know where testing locations are and what's available to you. There are, of course, local labs that can do the test and send it off, and there's a number of other options. I actually, very interestingly, heard about somebody today who got a prescription and from their doctor, and a service came to their house, took the test, and sent it off. So I think they're coming up with all kinds of creative ways to try and give people access to that.
Sounds great. And one of the follow-ups to that is, do the fire rescue crews test you for COVID-19 if they pick you up in an ambulance?
So no, absolutely. We do not test for COVID-19. If our patients are exhibiting any flu-like symptoms, we assume that they are positive. So we're going to wear our full PPE as we're supposed to, and the same thing with the hospital. They're going to assume that you are positive until proven otherwise, and that way that we're protected and the patient is as well.
And for those outside of what we do, what does PPE stand for?
I'm sorry, thank you. Personal protective equipment. So they would be wearing an N95 mask, goggles, a gown, things like that, which would offer them, and gloves, which would offer them full protection.
All right, and that's kind of brings up the question that was actually just handed to me. Is, someone has read that our first responders do not have the proper PPE. Is that true?
That is not true. Our first responders do have proper PPE right now. It is an ongoing concern, and we are trying to prepare. If you've watched anything with the federal government, local and state government, they are concerned about the supply chain. So we have been very, very careful not to excessively use personal protective equipment as we get further along in this. We're using more now as we get towards the peak, but we have a number of things in place in the early on stages where our dispatch would actually ask screening questions to determine whether or not a patient was exhibiting any flu-like symptoms or had anybody in the house that exhibited those types of symptoms. So in the beginning stages and early on, crews didn't have to wear those full PPE on every call. Now we've done some things where we've modified where one person will enter in full PPE, go in and talk to the patient. We even have the ability to call them on the phone while we're en route to the call and ask them maybe to meet us outside. So a number of those things will alleviate the amount of personal protective equipment that we're using on each call, but right now we are comfortable and confident that we are well protected. We continue to look at those and what our burn rate is on a daily basis, and try and keep informed through emergency management, Sarasota County, the Department of Health, to make sure that our providers stay protected. But it is a constant thing that we are working on, but right now I think we're in pretty good shape.
That brings up a question, and some of what you mentioned is, I know a lot of people want to know this answer, so, and I'm sure that you have a crystal ball, so when is the peak?
So it's interesting, if you look today and some of the websites that we've talked about today, the predicted peak in Florida is May 6th, but that's a moving target. So if you looked a week and a half ago, it was earlier, it was in April. Why is that change happen? There's a lot that goes into how they configure and figure those dates. I think with the people doing what they're supposed to be doing, people staying at home that don't have to, people protecting themselves better, I'm sure everybody's heard about this flattening of the curve, and the good part of that is less people ultimately get sick. The difficult part of that is it stretches that date out a little bit longer. So as we flatten the curve, we may be exposed to a much lesser degree of severity, but over a longer period of time. So it's finding that balance. But as I said, right now that date is, they're looking at an estimated date of May 6th for the peak here. That's different areas of the country.
And that's where I'm going to probably take multiple opportunities during this, because I'm sure some people will sign on and sign off. that kind of information of when the estimated peak, like you just mentioned, literally is changing on a daily basis.
Absolutely.
I want to refer everybody over and over again to go to our website, thecityofnorthport.com/alerts, and you can find all of this information out, and it will be more up to date than this will have as we move on. So please keep checking the site. It will have most of your answers will probably be there, and if not, you can certainly find answers from people through that option. Next question is from Cindy, and she wants to know, do you recommend wearing masks when you're out and about?
So yes, I think any level right now, any level of extra protection that we can give ourselves, I think is recommended. We've just recently gone to, even for our personnel as they're going out, if they're going to the store, we're recommending that they wear some type of protection. And again, that's, as we've received more information since the start of this, we've begun to realize that some people could be a transmitter of this disease and not be exhibiting any signs or symptoms. So I think to wear a mask out, as we talked about before, protects others from you as much as you from them. So we're trying to be cognizant and conscious of that. For us as healthcare providers, we try and balance that with, as I said before, we want to make sure that we have enough personal protective equipment to last us through this. So we're balancing that. But yeah, I think if you have the availability, we would definitely recommend it.
All right. You may or may not be able to help with this one, but it's kind of asking, what are your feelings about schools opening back up as a possibility? That's from Jamie.
Well, although I stayed at Holiday Inn Express, I'm not a school expert, for a little bit of light humor, but what I can say is I think as we look at this and go on, and we talked a minute ago about the peak, and you look at what the natural culmination of the school year coming up is, I think that's a daily basis. They're evaluating that. The school board, Sarasota County, the Department of Health, and along with all the municipalities, I think that's an ongoing and constant discussion. And albeit all of us are very cognizant of the fact that for some of our seniors, this is a very difficult thing, and certainly for all of our children, it's a significant change to what any of us have ever experienced in the past. But in an abundance of caution and in the effort to try and keep us as safe as possible, for a little while, this is just, this is the new norm. So I guess I'm thankful at this time that we have the availability for our children to continue going to school and be educated through a different format. And I think the school board has worked really hard to provide, mechanical devices, computer laptops for homes that didn't have them, to be able to get that. There's, lots of new mediums for Zoom meeting where they can actually be performing classroom, instruction at home. And it is different, and it's difficult, and it's emotional for a lot of our children, but I do think that it's the best thing, and I trust that the school board will continue to evaluate that and make the best decision as we go on.
Thank you. And I know that, again, the school board also has information on their website. As you and I both have seniors in high school in the Sarasota County school system, I know that my daughter's school recently put out a survey for the high school seniors. What do they want to do for graduation? And the school board, I think I get a phone call from them almost every day as a parent, not as a city manager, with updates on what the schools are doing and how they're progressing. So again, just like I'm recommending everybody go to our site for school information, definitely go to the Sarasota County School District's website. They have, if you scroll down a ways, you can get an update on the latest school board information. So the next one is from Margie. It says, what city functions are limited and what city functions are suspended? So I think I can answer most of those. Some of the city functions have been limited, such as our commission meetings. You'll notice those are all online right now. We're not currently doing any of the advisory boards except for the Planning and Zoning Advisory Board and the Zoning Board of Appeals, because those have to continue, but the others have all been suspended temporarily. As far as what city functions are suspended, you'll notice that like our aquatic facility is not open, War Mineral Springs is not open. We're trying to recommend people not utilize our parks. There are others inside the county that are outside of the city, like the beaches have been closed. But our city functions here at City Hall that are very limited. Where you can make your utility payments. All these, we highly recommend people do it online so that they don't have to go out at all. But if you don't have the ability to do that, our drive-through is open. You cannot come into City Hall right now to make your utility payments or building permit payments. So those are some of the functions that are limited, but we still have all of our first responders, our fire and police personnel are all working. Our solid waste folks are still picking up trash. They are still picking up yard waste, and I know that that's been a question a lot of people have had, is the information regarding the change in our process for yard waste. What we're asking people is, if you have yard waste that needs to be picked up, you can get a container from our solid waste folks, but you do not have to. You can put it in the disposable bags that you can buy at the store. You can bundle it up, but we are asking you to call in so that we'll know that we can schedule to come pick up your solid waste or your yard waste. But your regular solid waste, as long as your trash and recycles are in the appropriate bins, we are still picking that up, so that activity is still functioning. So hopefully that answers most of the questions on that one. The next one is from Luis, and it is the ER on Toledo Blade offering testing?
I don't know. I believe they do offer testing, but it gets sent out. So, and we can confirm and put something on the city website and follow up with that. But my understanding is any hospital that you go to has the capability of administering a test, but it's not the type of test that you're going to get and have results right then and there. One of our recommendations that we talked about previously was, if you're exhibiting flu-like symptoms and you're not feeling well and you just really want to know whether or not you have COVID-19, we don't recommend that you go to an urgent care or to an emergency room to find out, for a number of reasons. If you're just exhibiting, if you have a normal cold or if you have a normal flu, you're already immunocompromised. So now introducing yourself into that type of setting where there are people that have COVID-19, you're obviously at much greater risk of contracting it if you didn't have it before. So our recommendation is, if that's a concern, that you call your doctor, you work with your healthcare provider. They're able to do a lot of great things. We talked earlier about these new mediums of doing things for school, and doctors are doing some great stuff with being able to have consultation over the phone, consultation by computer. Some doctors are even able to write prescriptions as long as it's for non-narcotics. They can write you a prescription over the phone and send it to you to go and get tested, to go to a lab, to an area that is safer than going to an emergency room. So we don't recommend calling 911 or going to an emergency room if you're just trying to find out whether or not you're positive for this flu.
All right. Next one is from Mario, and it is, our property tax is going to be lower this year because of COVID? And I will take that one because it sounds like fun. But our commission has just recently had, right before all this started, we started our budget process, where we had a meeting with the commissioners. It was open to the public, where the commission sets their assumptions and priorities and projections for the year. That actually took place right before all of this started. But the real meat of the budget process, after staff gets done putting together some requests as well as levels of service evaluations, we'll start with the workshops in June. At that point in time, we'll present a recommended budget to the commission. They will make some changes, and that will determine whether property taxes are either lower, higher, or stay the same. So at this point in time, I cannot answer that, and I won't try to answer it because it's way too early in the process. But for those that want to have input, we highly recommend that you come to the commission meetings, or you contact your commissioners so that you can have your input. And they definitely, all of them I do know, listen. Many of them will even reply to you. So if you have questions or concerns, the entire budget process, starting with public meetings that are coming up in June, whether we're past this or not, the meetings will be open to the public. It's whether they're going to be open to the public in person or online in the Zoom meeting, which is what we just had this past week on Tuesday. I'm hoping that by the time we get to mid to late June, that we are back to where we're having in-person meetings. Next one is from Steve, and he wants to speak to the resources the city has in place for homeless and displaced individuals. I know that we have reopened. So when all this started, again, this was a fluid situation. We're trying to figure out our best way to handle this for all of the people in Northport, whether they be homeless or not, displaced. We're trying to look out for everybody. But when this originally started, we thought that the safest thing was to close the restrooms at the parks, because we knew that we could not guarantee their cleanliness all day long. As we turned out, that was not the correct decision to make, so we quickly changed that. So the parks restrooms at 3 of the parks have been reopened, because and they are cleaned 3 times a day. Main reason for that was utilization for the homeless and displaced individuals in our city. We also arranged to have a portable hand washing station as well as restroom at New Hope Church, because that's also where they're providing meals for these individuals, and it's a place where they already congregate. So we thought that 4 locations like that would hopefully help with this situation, and that's probably some of the biggest resources we have right now. We also have a social services division that still provides services, and we're doing what we can for that. Next is from Dennis. Is what are you doing to cut the expenses like every family is doing? So some of the items we are doing is we have put a freeze on non-essential hiring right now. We are looking for savings in every aspect, and going forward, we do this every year anyway, but we are going to be faced with some challenges, but at the same time, most of our expenses are not going away. With having our first responders, the fire and the police department, solid waste, all those activities are still taking place. Surprisingly to some, building permits have actually increased. They have not gone down during all of this. So all of those folks are still working. And actually almost all of our city employees are still working. They're just working remotely right now. So with that, there will be some savings, electric bills, uses of city facilities, such as our recurring water bill and items like that, I do expect are going down. But we have also eliminated some of the services that we use inside the city, like cleaning of buildings, janitorial type services. Obviously, with the people not here, we don't need those services. So those are some of the items we're doing that have immediately cut the expenses, and we'll always look for ways to cut them more. Next is from Edie. It says, are any city projects on pause due to COVID-19? Right now, all of our projects are still moving forward. We will see how this impacts some of them. Some of them are delayed. I can tell you one of the ones that's been a key issue for our commission that had to be extended was the ULDC, or the Uniform Land Development Code. That is completely being rewritten. It's been a project for this commission for several years, and we are nearing the end of it. We anticipate that it will be done this fiscal year, which ends in September. But we were hoping to have that done this summer, but unfortunately, one of the very next steps in that process is a public meeting to provide input at that, which was kind of a workshop type forum that was going to be held at the Morgan Center. Obviously, with the governor's order and all of the recommendations from pretty much everywhere to not assemble people in groups larger than 10, not to mention the Safer at Home order that was recently issued, wouldn't make it practical. And I'm not recommending to our commission, and I can't imagine that any of them that I've talked to would recommend this either, that we skip that step. So with that, that's one major project that's going on that is being delayed. All of our projects will be evaluated again, as was mentioned earlier in the budget process. If there's a reduction in revenue, some projects that may have to get pushed out or delayed even longer. So we're evaluating all of those on a day-to-day basis. From Margie, are all city employees receiving full pay or benefits? And if no, which ones are not? So right now, all of our employees are still actively working. Some of our part-time employees that we were going to hire, or some of our positions that were vacant, are not being hired. Only positions that we are filling right now are essential ones, mostly in fire and police or solid waste, that are still providing full active services to everybody. So those individuals are still being hired. Some people are not being hired due to the fact that we don't have the ability to have them here to train either. So again, every position is being evaluated, but all of our employees are still working full-time, so they are all still being paid. The next one is explain how to get yard waste picked up. So as I mentioned earlier, if you call our Public Works Department, their number is 941-240-8050. And if you let them know on your regular trash day, just like they've always done it, they would pick up your yard waste. So you call, let them know that you have yard waste that needs to be picked up. It needs to be, like I said, either bundled up or put in the disposable bags, or you can utilize one of the containers. I know that there's been a lot of question about whether or not you had to buy that container, because it's a $100 lease, but it's for the life of that container. It's not $100 a year; it's a one-time cost. But that being said, you do not have to buy that container. The only thing that we do ask is that you do contact them so that they know that you have yard waste out there that's picked up.
This is a great time to make a shameless plug for the fire department and for a little bit of fire safety. Although we had a little bit of rain today, we're experiencing some pretty significant drought conditions for the year. And we talk about yard waste. This is a great opportunity while people are at home to create a defensible space around their property. So if they have a vacant lot next door to them, to make sure that some of that brush and overgrowth isn't getting too close to the house. We want to look for at least 30 feet. If they have pine needles or leaves or anything on the roof, they can remove that material, because that's material that embers could light on fire if a wildfire were to go through. And we have a lot of areas throughout the city where there's some wildland urban interface, so sometimes we don't feel like we're so susceptible to that on some of the roads where there's multiple houses, but some of these lots that have grown have a significant number of years of growth that are there, and could create a problem if they don't concentrate on that defendable space. And it's a great time to be able to do that, and then to be able to call for a special pickup. So
sounds good. Next one is from Mario, and he asked, is the DMV still open in City Hall, with City Hall being closed? Currently, no. The DMV is operated through Sarasota County, and they have closed the offices that they had here in Northport for both of them, which is part of the tax collector's office as well as the property appraiser's office. They are temporarily suspending that service, as they have throughout the entire county. That being said, when the governor issued one of his executive orders, all licenses were extended for 30 days. I'm not sure what he will do after that 30 days is up, because I know that we're approaching that time frame. So if your tag for your vehicle expired sometime in the month of March, it was automatically extended for 30 days. So, but you also have the ability, again, to go online, and if you go to the Sarasota County website, you can find the links to that. But you can still renew online, and they will mail you your new tag, or if it's your driver's license, and it can be renewed that way. But no, they closed here at City Hall. They stopped coming down here a couple weeks ago, so they closed their offices right around the same time that we were closing City Hall. Next is for Scott. What can I do to stay safe daily?
Well, I think the biggest thing is if we go back to, and we've talked about it from the beginning of this, is wash your hands. We don't think about how much it's regular flu season now, in addition to this, and the amount of things that we touch and do, and then touching your face or things like that, covering your mouth when you sneeze, and then washing your hands, trying to stay out of maintaining that social distancing that is recommended. 6 feet really should be a recommended minimum, but beyond that, try and limit your trips to go out. If you need to go to the store, try and make a systematic list of the things that you need, so that you can minimize the amount of time that you're out and exposed to other things. If you need to get out, obviously we all get a little bit of cabin fever if we're stuck at home, so go and do some things like walking or jogging or riding a bike that's not in an area of congestion where it's it's safe and you're not around those other people, so you don't feel like you're just stuck into the house. But I think one of the things that we're seeing, and it's working, is if you look at the national statistics for even what's going on with the regular flu right now, the regular flu is significantly down from what it is on a normal year, and it's because we're practicing these things of safe hand washing and social distancing and minimizing our contact with each other. So these are some of the things that will become maybe some of the new norms for the future. Hopefully not quite as severe as they are now, but that hand washing really is a big thing. And then there are some people that are wearing gloves out, wearing a mask, and imagine and think about those things. Those are great, but if you are using gloves and you touch something and then you take your glove off, there's a meme out there right now where there's a gentleman, he's got a glove in his mouth because he's working on his phone. Well, he kind of defeated the purpose there. So think about things like that, and that would be my recommendation.
I don't think it's quite socially acceptable yet for us to put the cone of shame that we all give dogs when they have a face issue on. But that's, again, another step is keep your hands away from your face.
Absolutely. There's on the website too, and CDC has great guidelines for all the things you can think about and things that you can do. I've covered I think a fair amount of them. However, all that information is out there to help keep everybody safer.
Sounds great. And the second part to that same individual's question is, when will we open back up to normal?
Well, that's the big question, isn't it? So we talked a little bit earlier, and I know some people are coming on now. Locally here for Florida, our best guesstimate right now, and again, this changes daily as we receive more information, is that we'll be experiencing the peak of this pandemic somewhere around May 6th. As we work harder and do better in social distancing and doing all those things we talked about, that flattens the curve, and so that pushes that date out a little bit to where the severity that we experience as a community is not quite as high, but it may extend some of those things. And so, much like everybody else, as we began to exercise our continuity of operation plans for how we work remotely, certainly we'll do that same thing for how do we come back to work and get ready to do that. But I think it's a little bit early to say when we're going to be back to normal. I think it really would be the crystal ball guess at this point.
It is one of the things I want to make sure everybody knows. Like I sent to have all of our staff here at the City Hall, all of our director team and everything, working on a back to work plan. This one kind of came up on everybody quickly. We have great plans in place for emergencies around here, but those emergencies historically have been hurricane type events. So this is, like I mentioned from the beginning, a fluid event. So we actually are working on changing all of our processes for something like this. We have a ton of employees that are working from home. They're being productive. We adapted pretty quickly to that, which I'm very proud of our employees. One of the things I've asked everybody around here to do, and I'm sure that employers out there as well should be doing the same thing, and I know that there's guidance I'm kind of hearing all the states around the country are starting to think about, is a return to work plan. But I do want everybody to know that while everybody has started to work on a return to work plan, that's what they're doing, is they're planning. Keep in mind, our governor's safer at home order still is in effect for at least the next 2 weeks. So I don't want everybody to think all of a sudden, well, people are planning, that means next week they'll be coming back to work and all these things will be back to normal. That's not a realistic thing, but what everybody is doing is planning for what it's going to look like when we do, so that we can do this in the safest and best way for everybody involved.
And I think that one of the tough things is and there's been a lot of discussion about this, the longer something like this goes on, it becomes somewhat like the car alarm in the parking lot, where when you first hear it, you really pay attention. As time goes on, you don't. And so what we want to make sure is that the community stays engaged and thinks about those things they can do and follows that executive order, so that so we don't have issues, so that people don't let their guard down and stop doing those things that are making us all safer and better right now. And I have to say, as your fire chief here, that it's been very impressive. We deal with emergencies on a daily basis, so our department was somewhat used to doing some of this, although there's been a lot of changes for us. But human resources, working with all the rest of the city staff and emergency city manager and city manager's office to implement some of the things we've done and be creative. And although you say City Hall is closed, the amount of things that are still getting done on a daily basis, the continuity of operations is pretty impressive, to be able to do all the things that we're doing and to have been able to kind of shift that, I think, in a very short period of time, and to do that. So I think that's certainly worth mentioning.
Yeah, and I think our employees have done a great job in our community as a whole. And I have to say, our community is doing an amazing job of following the safer at home orders. There's always going to be exceptions to that rule, but the fact of the matter is our numbers are lower than a lot of the surrounding areas, and I believe that's because of the fact that people are doing these precautionary measures that they need to do.
And I didn't want the time to get away today before I did say something. I did want to say our community's been incredibly supportive of the city and our emergency responders. They've been sending over Publix and some of the other businesses, some of the restaurants, even residents have been sending over lunches and food and things that normally would go to waste, or things like that for our firefighters. I know that they've been supporting the churches in the area that are feeding meals, and just to see the things that our citizens are doing in the community to help each other. I've seen postings out there about kids, if they're not getting lunch, that people will deliver it and do all these different things. And I think that's a pretty amazing thing, and really speaks to the makeup of our community.
We have a pretty amazing city. Next one is from Edie, and it says, do you know where people can get masks?
Well, that is the question, isn't it? Right now, I will say, and I really have to caution everybody, there are a lot of scams going on right now on the internet, and it's very, very difficult sometimes to differentiate between what's legitimate and not. So in a world, in a society where we've become very, very accustomed to ordering things online and having that delivered by, Amazon in a day or whatever, I have to caution everybody that a lot of the things that are out there are not what they appear to be. So please be very careful. We as emergency responders, as I said, and I think we mentioned at the beginning of this, have some difficulty in getting the personal protective equipment that our personnel need to make sure that we're staying safe, and that goes not just for us but for the hospitals, for the nursing homes, things like that. So I think the best thing for people to do is they can keep checking locally at the stores here, and as supplies come in, have that availability. We talked earlier about cloth masks, and although usually that's not something maybe that we would necessarily recommend as a front line, certainly I think during these times when that supply chain is interrupted and it's difficult to tell whether or not something is legitimate, to do something like that for an added layer of protection is certainly better than nothing, and that would be our recommendation. Right now it is very, very difficult. I mean, the federal government, the state government, and our local municipalities are out there trying to find all of those supply chain resources to get those things to make sure that our emergency responders have that equipment that they need. And so, as you can imagine, if they're doing that with all those resources, for regular citizens, it's very difficult to find a reliable source for that.
Sounds good. Next question is from Dennis, and it is, why is the police chief not here? And, well, there's multiple reasons for that. The biggest one is I asked him not to be here. And we will be doing another one of these where we will have our police chief, Chief Garrison. But as you may be able to tell, I cannot see what you all are seeing right now, but we are in a fairly small room. And again, in order to practice social distancing and make sure there's not too many people in this room and we're not congregating and actually following the guidance that we're asking everybody else to follow, I did not want to add another person, but we will do another one of these with the police chief. The focus at that point will be more on a law enforcement and their perspective of how this whole situation is going. But that being said, we figured the health aspect that the fire chief can provide was the first one we wanted to do, and we will do more of these. So Chief Garrison is not here because I asked him not to be. So next is from Lisa, and she wants us to remind folks of the proper disposal of masks and gloves. So how would they do that?
So right now, for regular citizens, as far as masks and gloves, they need to go into a trash receptacle. They don't have to, it's not biohazardous waste because it's not proven exposure to a contaminated patient or anything like that. Certainly, I know that there's been some issues in some cities and areas where you've seen people disposing of masks and gloves, in the parking lot and on the ground. And I think that just goes back to being generally a good person, right? We throw things in the trash and take care of it. We don't want to pollute our area or our environment. As healthcare providers, we have a little bit different standard, whereas if we are interacting with patients that are known to have some type of a communicable disease process, we do have to dispose of those things in certain ways, and we have to do that through the hospital, through a third-party company, and things like that for biohazardous waste. But it's not the same standard for the regular public because they are not interacting at that level with them.
Sounds good. So Stacy asks, are there any places close enough to get tested if needed? And I think part of what you covered earlier is you need to, if you feel like you're susceptible or showing any of the symptoms that have been described earlier, is you need to schedule it through your physician.
Absolutely. And yeah, we'd absolutely recommend that. Make a phone call. If you're exhibiting any symptoms that you think that are emergent and you are having chest pain or shortness of breath, or you feel like you really, really have some emergent signs and symptoms, of course, there's always 911 that you can call, but we don't recommend it unless those are severe symptoms, you're having a problem. We recommend you call your healthcare provider, and they can direct you to how to get a test if you think you need to. Because certainly you are more susceptible if you go to the emergency room or urgent care to get tested. You're more susceptible to getting COVID-19 if you don't have it because you're immunosuppressed. So,
sounds good. All right, and again, like I mentioned earlier, one of the things I want to remind everybody is if you go to our website, which is www.cityofnorthport.com/alerts, you can find out updated information. There are links on there to the CDC, Department of Health, as well as updated numbers for how many cases and what zip codes they are. But that is the best place. It's a shameless plug for our website, but again, we're trying to make sure everybody gets the most accurate information. So that is where we're directing everybody to go. There's also the City of Northport app, the North Report, that will provide you with, if you set your push notifications, every day you'll get an update. So again, those are some good opportunities for you to get information on a recurring basis and up to date. So Michelle asks, can you still get a permit? And the answer to that is yes. One of the things we still have open is our drive-through window. You can apply for permits online. You can pay for them online. Or if you have documents you need to hand submit, you can bring them here to City Hall. Our drive-through window that is normally for utilities is actually working for both utilities and our building department right now. So that being said, the answer to your question is yes, you can. Jessica asks, she heard we're doing innovative things regarding the spread of COVID. Can other fire departments call to see what you are doing?
Absolutely. One of the things that we do right now is we have a chiefs conference 3 times a week where all of the area fire chiefs here in Sarasota County from municipalities and the county fire chief, we talk about what we've experienced, what things that we're doing that have worked well for us. And we've learned some things from surrounding agencies. They've learned some things from us. And we've also looked, as this has gone on, to departments as far away as FDNY. Some of the separation we have for our crews and some things that we've done were lessons learned from where they had some cross-contamination and exposure between crews, where they lost an entire fire station worth of people. So we looked at how that happened and how possibly we could prevent that here. And daily we're looking at things and lessons learned from other areas. So absolutely, we welcome any phone call. We'd be more than happy to help others, and we welcome the opportunity to do that and their suggestions as well.
All right. Next one says, are we allowed to fish in the canals by our houses legally? So the laws on that have not changed at all for this. So again, if it's by your house and you were allowed to do it in the past, that has not changed. Nothing here related to COVID-19 has caused any changes to those laws. So Bob asks, should customers wear gloves to the grocery store or are masks enough?
So gloves, again, are good as long as you're very, very conscious about not cross-contaminating. So what we really recommend, because some people can get gloves and some don't, is be very conscious of the things that you touch and then washing your hands and not touching your face, not touching your eyes, not touching your nose. So as you're picking up things at the grocery store and putting them into the cart, you pay for them, there's hand washing stations there. You go out to your car. A lot of people hopefully have hand sanitizer in their car. You can load their groceries, clean their hands as they get in their car, and then kind of do that same thing when they get home. It's a little bit more of a cumbersome process than what we normally do, but it's I think, again, reminding us, we talked earlier about maybe the new norm for some of these things, and I think that will become a little bit more of a routine for people. So gloves certainly don't hurt as long as you use them properly, and we're really, really conscious of not cross-contaminating, but most importantly, I think if you're very, very diligent about hand washing and being aware of what you're touching and touching your exposed areas, I think is even more important.
All right. The next one is from Jacqueline. She's asking, is borderline blood pressure considered suppressed immunity?
Well, typically, as a general rule answer, I would say no. I'm not a medical physician, although I am a paramedic. So there are a lot of etiologies that can cause borderline blood pressure, and depending on what that is, I think there are maybe some immunosuppressed conditions that could cause that. But typically, blood pressure is a number of different things that are cardiac in origin or hardening of the vessels or some things like that. So if you have any questions, we would recommend that you contact your physician and ask them that question. But I would say, as a general rule, no, that's not a regular and normal byproduct of immunosuppressant.
All right. Marie asks, where is the testing set up in North Sarasota?
I don't have, actually they just announced the location today, and it is at a community center, and I think we will have that link online maybe tomorrow. I don't think we have that address. I think they just changed it. It was at Clark Road. They were doing that at Twin Lakes Park. I know that they have moved it downtown, and I don't know if it was actually going to affect tomorrow or not, but I want to say there's a community center there, and the name is escaping me. We've got some staff that are, I'm stalling a little bit there. The Robert Taylor building. Thank you very much. Robert Taylor building, we're going to be, and is that starting tomorrow?
I think we'll announce it.
Okay, we'll announce it, and we'll make sure that gets put out on the website.
Yep. All right. So,
thanks for the help. That was a phone a friend. Typically, we were hoping we wouldn't have to do that, but as unscripted and live, sometimes you have to do the best you can.
All right. And Carrie asks, how are you helping with the overwhelming amount of calls coming into 911?
So it's actually interesting. That's a great question. We have actually found out one of the things at the very front end of this that we did, our PIO for the city and our communications division were very helpful in us getting a message out. We did a radio show. We did some things for the newspaper and tried to get some things out on social media that talked about when you should or shouldn't call 911, especially in light of what's going on right now. And one of the things that we found, and this is not unique to us, is that our overall call volume is actually down a little bit for normal types of calls that we normally would run on, but our flu calls and flu-like symptom calls are up. So I think that people are beginning to realize that there are certain things maybe they don't want to call 911 for, and we talked about some of those earlier where maybe you might go to an emergency room for certain things in the past that right now you'd be much better to just call your doctor and try and go through that process and be evaluated online if it's not truly emergent. So again, we're not at the peak of this yet, so we do anticipate there will be an uptick with that. But right now, we've been managing it pretty well.
All right. The next question is, how are you containing the 30 people who are COVID positive?
Well, we don't contain them. So first, I'll clarify that. Most of these people are, they're under the care of a physician. They are following directions of CDC guidelines. And one of the things I can say that we do as a 911 emergency response agency is if somebody calls 911, there are some pre-screened questions that are asked, and if there's somebody in a residence that is COVID positive and we're going to be going to that residence, we know up front, make sure that we have the appropriate equipment on, and then also to make sure that we can take those people to the hospital, that the hospital knows that they're coming, because there's certain precautions they want to take and make sure to help prevent that transmission. In addition to a lot of things that we do then outside of that, certainly we have a machine that helps decontaminate the back of an ambulance, which protects our people from getting exposed to those types of things after the call, and also prevents the next patient from being exposed and having that cross-contamination. So we've done a number of things there to help, but we don't contain those people, but certainly they are under quarantine, under self-quarantine, and under doctor's care.
All right. Next says, any idea if the pool will open if things go back to normal in May? We are, and that's part of what we're doing with our staff, is making sure that we are ready so that we can return to normal as well. I can tell you that we have ready to go lifeguards for the new aquatic facility. So if things should return to normal, we will be prepared to open all of our facilities. So that's part of the plan that I mentioned earlier. Everybody is planning for how are we going to return back to normal, and that it does include the aquatic facility. So again, I appreciate the fact that your question is if, because if things do return to normal, yes, we will be able to open. Dennis asks, is crime up or down? And right now the answer to that, crime actually is down, and the overall calls for service are also down. So who knows? Maybe the bad guys are actually practicing social distancing as well. That's what we can hope, I believe.
And back to one of your previous comments or questions, Pete, was on. Sorry, I drew a little bit of a blank there. When you were talking about opening back up and in consideration of that, obviously, there's a lot of things that go into that question and comment. We talked about the car alarm earlier, and as it goes on, and people begin to be a little bit less fazed by some of the things that we're doing. But more importantly than anything is we don't want to reopen things or get back to normal too quickly, because obviously the catastrophic cause to that could be, another spike and having issues. So we're very closely monitoring at the state level, at the federal level, and the local level what's happening around the world, just like we do as the fire department. We talked about earlier, trying to lessons learned and look and try to anticipate and project to the best that we can what's going on, so that we're best prepared to make that decision when the time comes.
Sounds good. So Stacy asks, what kind of resources do we have for the elderly, and how are we keeping them informed that we need to help our neighbors?
Well, I'll let you weigh in, but certainly we have our city website. We talked a little bit before about it. We have the North Report application that they can go on. We have for all of our nursing home and assisted living facilities, of course, there's staff there that are helping to educate them. We have the ability, of course, although things have slowed down now, we still have numbers at City Hall where people can call and ask questions. Certainly fire rescue is open. If people have questions, they can call us anytime. Sarasota County is available through emergency management and our local emergency management to answer questions for anybody. I think we live in an age where even our elderly population, many of them have become very adept at all the different mediums of communication that we have and have the ability to reach out and ask those questions, whether it be through social media, telephone, video conference, website access, or any of those things. So.
And I also will say, every day there's articles in the newspaper that they are capturing information that the city and other agencies, county, state agencies, and everybody are also putting out. Every day, one of the things that I get to start the day is an email of news stories, and usually there are no less than 5 or 6 stories from newspapers related to COVID updates. It's typically the first 5 or 6 stories that I see. So we are, the elderly, which is a population that tends to focus more on still on print media, while many of them do utilize social media as well as the internet, they also have that aspect of getting it there. So one of the other questions that were asked is, are our police protecting themselves with masks or gloves when on patrol? And I do know that when they answer certain calls, again, back to what our 911 is doing, the police 911 is handled locally, but some of the questions are asked before somebody shows up at an event to try to find out if there is any symptoms that they need to be aware of. They are practicing social distancing the best they can, but they also do have personal protective equipment as well.
They do, and we're working very closely with them to monitor that in situations where they should or shouldn't be wearing personal protective equipment, and they've been very helpful through this process, and we're working very closely with them to make sure they're protected.
All right. One of the other questions I had is, what is the city doing to help local businesses and workers during this time? And we have at City Hall here, one of the things we've done, we've dispersed them out of City Hall, but our Economic Development Division, which is very active, has been working closely with the Chamber as well as the Economic Development Corporation of Sarasota County to help businesses and their employees in the area get access to all of the federal stimulus programs, making sure that they're aware and helping them try to get through the process. I know that process can be frustrating at times, but we're doing our best to make sure that we're helping the businesses, educating them and making them aware of what programs are out there, as well as trying our best to walk them through the process. And I know that Sarasota County just recently allocated some resources as well for county-wide to help with the business and community, as well as, like I said, providing loans, providing other resources to help the businesses get through this. We all know that this is one of those things where we're all in this together, and everybody is pulling together to get us through this. One of the other questions is, how can we participate in city meetings? The city just had its first all virtual meeting back on Tuesday. We did that through a Zoom meeting platform. I think it went very well, and it was our first effort at that, and that's something new. But again, through that process, you can go to the website to find out how you can submit public comment or follow the meeting itself. Our meetings for a long time have been broadcast online through our city website as well as through YouTube. That has continued. We also now have these Zoom meetings, so you can participate that way. You can submit your public comment ahead of time. There is a form that opens 9 a.m. the day before the meeting. You can submit it that way. There's also a dedicated phone line where you can call and leave a message. So you still have the ability to provide public input and participate in the meeting. And if you submit through the online forum, you can do that all the way through the meeting, up until the time that public comment is closed towards the end of the meeting. And I can tell you those come straight into my email, so if you submit that form, your public comment will be read into the record during the meeting.
Do you have to fill in all those parts of the form?
And there are required fields on there. One of the things that we've done to update, biggest, we had one small issue last meeting, and we provide some clarification on that. Is it, as has historically been the requirement, when you come to a meeting and you give public comment, the first thing you're supposed to do is identify yourself by giving your name. That is one of the required fields for the online form as well. And by filling in your name, it does not mean to fill in anything other than what is your given name. So please don't write something like concerned citizen or just put some characters in there. We actually need your name. So that being said, I think we actually are out of questions that I have for our prepared questions, and it doesn't look like anybody else has any more that have been submitted online. So I don't know if you have anything you'd like to wrap up with. One of the things I would like to, again, shameless plug for our website, cityofnorthport.com/alerts. That's where we keep all of our information, as well as the links to the CDC, the Department of Health. I highly recommend you go there. And our communications team does a great job of updating our Northport app. So if you do have a smartphone, please feel free to download that app. It's free. And if you enable the push notifications on your phone, it will send you a message at least once a day. And they would love to communicate with you.
And I'd just like to say thank you to the public, the community, for supporting us. And thank you to our firefighters, police officers, paramedics. This is an extraordinary time for all of us, and certainly a level of stress and a difference in their jobs than we typically do on a day-to-day basis. It is what we do. It's what we train for. But we're not subjected to this level each day, and at a time when a lot of people are working from home and having some of those struggles right now. All of our firefighters and paramedics are here every day. Actually, we've told them they're not taking their vacation time, so that we can make sure that we're adequately staffed to be able to provide for this community, and they have very, very graciously taken on that challenge, and I think done a great job. We're thankful for, like I said, all the community support, the support of the city, to enable us to do those things, and we feel like we're really well equipped to be able to handle this, and we're looking forward to coming out the other side as a stronger community. We appreciate it.
Yep, like I say, I couldn't echo those words strong enough. Our community has been extremely supportive. We're doing the best we can. This is a fluid situation, and I think the last pandemic was probably before any of us were alive. So hopefully we don't have another one of this for a very long time. But I believe we're doing a great job. I believe the city employee team has come together. I believe our community has come together. And while there will always be hiccups and always things that we could do better, I think we're doing an amazing job. And I'd just like to thank all of our employees, the community as a whole, and the commission for the support that they've given us, so that we can help get the community through this hopefully once in a lifetime event. So with that, thank you very much.
Thank you.